Okay, now today our speaker Dr. Smita is from Canada and senior homeopath and a very good experience. So let's have a talk uh, from Smita. Yeah, Dr. Smita, go ahead.
So, good morning and good evening, friends from everywhere. Today I'm going to share with you all the insect remedies in homeopathy. And first of all, thank you to Dr. Kalathia sir for giving me this opportunity to share my clinical experience. And yeah, it has been quite some time since I have been practicing homeopathy in this way according to kingdoms and according to I also did my FHPC fellowship in homeopathic psychiatry uh, last year, two years back. So that has also helped me to analyze in this way. So let's begin. So first of all, I would like to let us classify how do we come to insect. So what is insect group of remedies? It is the invertebrates. So first of all, animal kingdom is classified into vertebrates and invertebrates. Okay, so so what is vertebrates? To understand this better, let us see the next slide. So in vertebrates, there is backbone, and in invertebrates, there is no backbone. In vertebrates, they have a well-developed structure. The nervous system is very well developed. And whereas in invertebrates, their nervous system or the backbone and the nervous system is not well developed. Yeah. So they have a simple nervous system or simple ganglia in invertebrates and very well developed nervous system in invertebrates. So more, next one. So as we already discussed, vertebrates are more evolved. According to the PEM, the evolutionary classification of homeopathic remedies, we say that because vertebrates are more evolved, they have a better backbone, better structure. So those personalities will be more evolved. They like the mammals, the birds, reptiles. They are more evolved. They are better evolved. They can grow bigger and they live longer. Whereas the invertebrates, their backbone is the exoskeleton. It is not the endoskeleton. It is exoskeleton. They don't have internal backbone. There is no complex or well-defined nervous system, and they have a shorter lifespan. So because they have a shorter lifespan, they are very busy. They are full of activity. They want to do things and finish off things very fast because their lifespan is less. They know that they have a limited lifespan. So they are very hurried patients. Like they are very hurried. And also there is a feeling of smallness or vulnerability. So because they don't have a backbone, they feel unprotected and they feel very fragile from inside. So again, we are discussing about invertebrates. They don't have a good nervous system, so they break down easily. They cannot handle things. So how do we see when a patient comes to your clinic? How will you see? First of all, when you are thinking in terms of remedies, how do you see that if this is according to how the patient is entering, how is the gestures, the talks, right? You need to judge according to all these things, the observation skills. If the patient sitting in front of you is showing invertebrate qualities or the vertebrate qualities. If you come to an animal kingdom, that is. So how will you see that? So you can see that the patients are very much hurried. They are very restless. They are very fidgety. They will not sit quietly. They will have something in their hand or they will be very nervous. They will do something with their hands, the fingers, or scratching the nose or something. They will be doing something else along with while talking. Okay, they will not be very focused. So, so because they don't have a good nervous system, they will break down easily. They cannot handle things. The talks will be like, I cannot handle. So whenever there is a stressor in my life, I am not able to handle that stress. I cannot tolerate there. So something happened in my life. I am all alone. I am fragile. I don't have the capacity to handle this. Okay, so this will be their talk. And you can see that the talk is also exaggerated. Their voice will be exaggerated. The tone will be exaggerated. They will look quite animatic, like animated. So their expressions will be animated. Okay, so they also think that they are very small. The feeling of smallness, because they feel that vulnerability. They have shorter lifespan, as we already spoke. Usually they need support because their backbone is absent. They will be like very much, I need support, I need someone, I cannot handle. This will be their talk. Their talks will be all self-centered. It's like narcissistic. Because it will be focused within themselves. So they will just keep talking about themselves. They are not bothered about their family. Not much. They will not talk much about their family, their kids, the social things, or what is going on in politics or the world. Their talks will not be around others. It will be more about themselves. And they express they want immediate gratification because they're impulsive. Their instinctual work is through instincts. So they want immediate gratification for whatever they get a thought, then they have to do that. So they want to, okay, they think of that thought, okay, now I want to do this. In the next moment, they might think of they want to do something else, and immediately it has to be done. So it is like immediate gratification. It could be impulsive shopping. It could be foodie. They could be foodie. They want to eat something. They want immediately, like that. And also, specifically, you will see that they lack in morality. They don't have good moral sense. So like they don't have the thing that they will not be like polished. When you see the patient is coming into your consultation room, you will see that they are very unpolished. They will sit with their feet on the chair. Okay, they will sit with ease on the, so they don't have that moral sense that, okay, I am at this place and I need to behave in a certain way. I'm outside. They will not have that feeling. They will behave as if they are at their own home. And then sensory inputs they cannot tolerate. So you will also see in invertebrate cases that they have sensitivity to noise, sensitivity to bright light, and there will be immediate reaction to that. They will have a violent reaction. And all their talks will be, all the things around me are troubling me. The fever is troubling me, the headache is bothering me, they are doing this, and this is happening to me. And they will be like all the time, they will be at the back of you. Dr. Smita, doctor, I want this, I want immediate thing. So I'm having this, give me something immediately. This, your remedy you gave this, it's not working. I need something else. So they want immediate attention. Again, you will also see a kind of possessiveness. Possessiveness towards materialistic things will also be there because they are more materialistic. They don't have that moral sense or moral values for emotions. They want materialistic like pleasures of life, right? Also, you will see a kind of jealousy, which is common in all the animal kingdom. And specifically now, how do we differentiate invertebrates and vertebrates? Here in invertebrates, you will see the sensitivity is like of the plants. It is plant-like sensitivity, especially when you see in aquatic invertebrates like the pre-mollusk and the mollusk. You see a plant-like sensitivity. And their actions are monotonous. So they will be doodling, they will be knitting, they like monotonous actions. One thing, they keep on doing the same thing. There is repetitive actions in their tasks. So invertebrate is again classified into aquatic, terrestrial and aerial. Aquatic are the sea creatures like the pre-mollusk, the mollusk, sponges, crustaceans, etc. And terrestrial are the insects, the flies, ants, butterflies and all. And aerial are the spiders. So in aquatic we see the mollusk, pre-mollusk, crustaceans. In terrestrial we see the insects, the flies, butterflies and ants, beetles, all those things. And aerial are the spiders. So this is the classification of insecta. We'll come to it later. So again, classification Animalia, phylum Arthropoda. Arthropoda is again divided into insecta and arachnida. And now we are discussing about insecta. So see, so phylum Arthropoda is having again 4 classifications: the arachnids, the crustaceans, the insects, and the Myriapoda. Myriapoda is millipedes and the centipedes, the worms. So these are different insects. Okay. Insect group is classified as follows: Hymenoptera, Orthoptera, Lepidoptera, Coleoptera, Hemiptera, Diptera, Siphonoptera, and Dictyoptera. So again, what are the insect themes? We have already gone through it, but I'll just go through it again. The key characteristics of insect remedies are quick and fast, sudden action. So they are very quick to react, quick to take decision, impulsive, instinctive, right? They are busy. They want to be busy. They want to keep doing something. It's not that they are productive, but they want to keep themselves busy. They are very much occupied within themselves. They want to keep doing whatever they are doing. And it is fruitlessly busy. Usually they are fruitlessly busy. So this industriousness you will also see in mammals. Okay. Industriousness is also seen in mammals, but then when a mammal case is there in front of you, you will see that their focus is on being more productive, more useful for others, or how to improve on themselves, as we see in birds. But whereas in invertebrates, it is like they want to keep themselves busy fruitlessly, like they want to just do the action so that they are occupied. Also, you will see more anger issues in insect themes. So irritability, anger, rage, violence, attacking and being attacked. You will also see sexuality and attractiveness. So there will be people who will want to show their attractive, they want to attract, right? Because the insects personalities are attracted towards the flowers, the nectars. Also, they have their this sexuality is more prominent in that. So they will be more into beauty, clothing, makeup, and being like up to date with fashion. All those things you will see in a patient when it belongs to insect remedies. But having all, I mean, even though they are doing all this, you will see that there is low self-esteem. Now, why is there low self-esteem? So, because there is low self-esteem, they want to present themselves as attractive, right? There is low self-esteem because they are fragile from within. They have weaker ego. It's not that well developed. It's not that well evolved. They have the feeling of dirty self-disgust also will be seen, and self-hatred can also be seen in some cases. Then there is rush of flow of thoughts. Their thoughts, when the patient is talking, you will see that the patient is shifting on various topics. Like he will shift on one side, he is giving the history, the past history. Immediately he gets a thought about something happened in my office. He goes there, then immediately he will think about something else. So that way he will be shifting from one topic to other. You will observe that in the cases. So because their thoughts, there is a rush of flow of thoughts. They have overthinking as well. Aversion to water and hydrophobia. They have hydrophobia. Most of them have hydrophobia. And physically, you will see swelling, puffiness, inflammation, lot of inflammation in the body. And their pains are usually burning, stinging pains, biting pains, you will see in cases. And their talks is hasty talk and loquacious. They are usually loquacious and they shift from one topic to other. So these are some of the examples of insect remedies. Spanish fly, overreaction, mania. Spanish fly is Cantharis. Stabbing pain and burning pains you will see. And we usually use it in cystitis or burns, right? We use it in urinary tract complaints, the Cantharis. Indian ladybug or the beetle, Coccinella, it has a hard shell, but they are very fragile from inside. They feel very vulnerable from inside, although they have a hard shell. They feel bullied. They feel they are being used. Also, they will have a feeling of being guilty and stability. And also they want to do something good for others. This also you will see. So I don't have that much time, but sometime later I might discuss this in more detail, that you will see that thing that they want to do something for others. Okay, and they also in return they will expect that, and when that is not they don't get that, they feel depressed. So I have a very good cases of depression of Coccinella. I will share sometime later, not today. Okay, so this is Indian cockroach, Dictyoptera blata orientalis. They have anger, cursing, indifference, ambition for status. Culex, mosquito. These symptoms are harassing. They have extreme irritability and anger, and they are very aggressive. What is the miasm? We already know that it is malarial miasm, because the patient feels harassed. The patient, I mean, you will also feel harassed. If the patient is in your clinic, you will also feel harassed. So it is that kind of personality. It's very extremely irritable and they're harassing. Okay, so this is Mahesh Gandhi sir's classification of invertebrates. I will also come back to it when I share my cases today. So this in general, you can see there is classification of aquatic and terrestrial and the aerial. And okay, so aerial, and in the aquatic you can see the water, earth, fire, and water you see the mollusk, right? The pre-mollusk. In earth you see the mollusk, in fire you see crustaceans. In terrestrial is the insects. We are talking about the insects here. So today we are talking about the terrestrial, and aerial you see the spiders. Okay. So again, this is further classification according to PEM. Insects belong to the infancy and childhood as placed by Dr. Mahesh Gandhi sir. It is the evolutionary stage is the infancy and the childhood, early childhood. And in that further classification, you will see Homoptera, that is apis, that is the bees, the coccus cacti. You will see in the womb stage, Homoptera, and in Heteroptera, you will see womb stage, Simex. So all these you can take a screenshot. School age, you will see Orthoptera, that is locust, grasshoppers, cricket. Adolescence is mostly the Lepidoptera, that is the butterfly. In butterfly, you will see mostly predominantly is the adolescent stage. In adult stage, you will see the Hymenoptera, Coleoptera and Odonata. So in Hymenoptera and Coleoptera, you will mostly see ants, bees and the beetles. And in Odonata, you will see the Dempsey fly and the dragonfly. And these are mostly belonging to the adult stage of development. Also in old age, what do you see? The cockroaches in Dictoptera, you will see in old age. Also the termites and Culex musca. The flies you will see in the old age. Musca domestica, Culex, the fly and the mosquito you will see in the old age. Okay. Now, this is a case of behavioral disorders and motor tics. I saw a year back in my clinic. It is also called as the Tourette syndrome. So, Tourette syndrome is a neurological condition that causes involuntary motor or vocal tics. So, what are motor tics? Motor tics are a tic is a uncontrolled, sudden, repetitive movement that is difficult to control. So, tics involving movement are motor tics. So, there may be eye blinking or shoulder shrugging, the head jerking, nose twitching, lip twitching, or there will be neck movements. I also had a patient with neck movements. There is difficulty swallowing. They might be saying that there is difficulty swallowing. There is facial grimacing. So you will see that the patient is making gestures, all these gestures and the facial grimacing, the shoulder shrugging, this all comes in motor tics. And what is vocal tics? Vocal tics is sniffling, throat clearing. They have the tendency to clear the throat like that. They will do the gruntling, the barking, the humming. Then repetitive words. They would have a habit of saying repetitive words or calling out. Okay. So all these things are the vocal tics. Okay. So in this case, this is a case of 14-year-old boy brought to me by his mom for motor tics and ADHD or a behavioral disorder. So his basic behavior was, this boy was extremely hyperactive and had violent and destructive behavior since childhood. So he was very, very obstinate. He was very defiant. He was very vivacious and animated and impulsive. When he came to the clinic, he was we could easily observe that he was very vivacious. He was not shy. He talked with me very openly. And his also talks were animated. His gestures were animated. And his mother told me that he is very, very hyperactive and destructive as well. And he is very defiant. He doesn't listen to what people are saying. He doesn't like to be told. He will do whatever he likes to do. Okay, physically he was very restless, fidgety. He did involuntary hand gestures and finger clicking. Continuously his hands were moving and he was doing finger clicking like this. So he could not keep still at one place. He did not like if somebody would come near him. Okay, this was also one of the features which his mom shared, that he doesn't like when somebody comes near him, or he doesn't like to be touched. Immediately he would scream loudly if somebody would come near him or touch him. He doesn't like that. He also had the habit of touching and pulling his genitals often. So this also was shared by his mom, that he handles the genitals and he does that in front of anybody also. Like he would do that in front of in the class. The teacher has also complained that. So which was very embarrassing for the parents to say that. And his mentals were like, he was very loquacious, he was self-centered, he was rude, he was jealous and stubborn. He was very stubborn. Self-centeredness we could see because he was only worried. He had a sibling too, but he was not like he wouldn't be bothered by what his sibling is doing. He wouldn't play with him. He was very focused on himself, and he was very loquacious also. He was rude. He was not well behaved in the class. He would give back answers to the teacher. The teacher had complained that he gives back answers. He doesn't listen. He is very stubborn. He would not listen to, he would not follow instructions. And he had these features, typical fears, that he had a fear of being approached or touched, as we already spoke about it. He had fear of water. He had hydrophobia. He had photophobia, fear of bright light. He had fear of death. He had fear of ghost. Emotionally, he was oversensitive boy since childhood. He would get offended easily. So his mom said that he would get very offended easily. He needed a lot of respect. So he could, like, if you don't pay attention to him, what he's talking, he would get offended and he would throw a tantrum. If the parents are not listening, if they are ignoring him or anybody else in the class, if the teacher is not listening, so he wants that attention seeking, and he would get offended easily. He was very oversensitive. He would throw a tantrum, and he was also very obstinate and stubborn and complaining, dissatisfied and swearing. He used bad words. Okay. And he liked to dress up fashionably with bright and attractive colored clothing. Okay. He had a craving for sweets and crunchy food. His thermals were hot, and his stools were sometimes loose stools mixed with mucus. His dreams were sexual dreams of unsuccessful efforts to urinate. This also was he shared that he felt that he is about to pee, but he is not able to pee. That was shared in his dream. Okay, so any guesses from the participants of the
Mamta
remedy?
said it's a blood.
Okay, good.
Anybody else? Pritika said it's some Kantheris. Monica also Kantheris. Yeah.
Okay, good. So his overall behavior was violent and aggressive, loquacious, sexuality, attractiveness, jealousy, quarrelsome nature, right? All this showed animal kingdom. We all came to animal kingdom. We all know that we are talking about insects today. So, right? In animal kingdom, but when we don't know that if it is an insect, we discussed the invertebrate qualities, right? So he was snappish, he had low moral sense, he was self-centered, he was aggressive, instinctive, impulsive, right? So that we come to invertebrates. In invertebrates, I could see the energy of the boy was like insects because he was very hyperactive. He was not sitting at one place. He was constantly fidgeting. He was making gestures with the hands, fingers, and reactive and instinctive. So now the question was which insect shall we give? And when we go to repertorization, we would typically get Belladonna, Stramonium, Hyoscyamus, Veratrum, etc. were showing as the main remedies. So how do we select the simillimum? So according to Mahesh Gandhi sir's chart, insects in general fall in infancy and childhood. And in that, we need to see what was the patient's inner age. Here our patient was someone who would get offended easily. That means what? His ego strength was very weak. So ego strength is developed. When he was offended easily, that means his ego strength is well developed. That means he needs respect. So he has a lot of pride and haughtiness. So where do we see this? So insects basically are infancy and childhood. So their stage is infancy and childhood. But in that infancy and childhood, again, in the further classification, how do you classify according to the Mahesh Gandhi sir's chart? You can, let me bring up the charts again so that you can see. Yeah. So this is the early childhood and school age, and this is adult age. Okay, adolescence and adult. So now he was very sexual also. So where do we put this guy into? Which stage? Either it could be adolescence sometime, but mostly it
Adult.
is adult. Yes, it is young adults. Correct. Okay. So this is, he was very sexual, handling genitals, sexual dreams. So all this shows young adult stage. In adult stage of insects, there are two types, Hymenoptera and Coleoptera. That is basically the ants, the beetles, and the bees. And this was the repertorization thing, where I took gestures making involuntary motions of the hands. Hydrophobia I have taken. He had fear of being injured, fear of approaching, like he did not want to be touched, right? So touched lest he be. I think it will not be completely seen this side, but it's okay. Yeah. So concentration difficulties, swearing desires, right? Destructiveness, grasping genitals, children in, and involuntary motions of the hand. We see Stramonium, Hyoscyamus, Naxwamica, Belladonna, Cantharis, Phosphorus. And here we come to Cantharis because we could clearly see that it was not a plant, it was not a mineral, it was not very organized, not very structured, right? So it was, and from animal kingdom it was Cantharis. Cantharis was coming closest. Follow-up, after 2 weeks, the patient showed much improvement in his behavior. Still the motor tics were the same, but overall a little behavior was improved. Cantharis 200 was repeated weekly. They came after 2 months. There was much improvement in his overall behavior. And slowly over the span of 8 months, his aggressiveness has come down. The teachers have given positive feedback. The motor tics, the frequency of the motor tics has also reduced, and he is able to focus and concentrate very well. So this was the case. So yeah, so almost 1 year they have followed up, and the Cantharis was stepped up from 1 m to 10 m, and in between, like it was not repeated frequently, like but intermittently it was repeated, and then we see the behavioral issues much developed. The hyperactivity was less. Anger issues were he mellowed down. His mother was very happy. His masturbation and the motor tics were also negligible. Okay, so case number 2 is a case of chronic urticaria and depression. So this is hives. This patient came to me with chronic urticaria and hives. It was like almost like angioedema. She had puffiness of the lips, puffiness of the eyes, swelling of the eyes, and also she presented with depression. So this is a case of 45-year-old female who came to me with complaints of severe hives or urticarial rashes and episodic depression. Her urticaria started whenever she experienced emotional stress. Like, so she said that she would get bouts of this urticaria, episodes of urticaria, whenever she had emotional stress. And what was her emotional stress? So upon case taking, upon communication with her, like I came to know that what was her stressors is she would get stressed if her husband is not in the town, if her husband goes to US for work, if she had to manage. She was from Canada, and her husband had project works in US. So she would feel she had to handle everything by herself. She was staying with 2 young boys, She was mother of two young boys, and she had to handle everything by herself whenever her husband was out of town. And that time she would get stressed and she would get these hives. She started getting severe hives and urticarial rashes with severe itching, like angioedema. And emotionally, she had also episodes of depression on and off, where in depressive phase she would have low appetite. She would feel amotivated. She would feel lethargic, and this was not her nature. This was not her basic nature. So this was life space of the patient. The middle-aged woman appeared younger than her stated age. When you observe that lady, she looked quite younger than her stated age. She was quite loquacious. She was talkative. She was wearing fashionable clothes and makeup, and she was well dressed. And upon questioning about her basic nature since childhood, she said she was very bubbly, she was extrovert, she was energetic, active, very cheerful girl. She would love to go outdoors, she would love to socialize, she would have lot of friends. She would like to socialize, she would be like a party person. Like she would like to go to parties, she would like to dress up nicely, and she would like to impress people. She would like to talk with friends. She was very loquacious. But in depressive phase, she would turn introvert and she would be very dull. We saw that in that is episodic depression. Her basic personality was socially outgoing, used to love to party for family functions, dressing up. She was attention seeking. Her charisma was such that people would be drawn to her in the party. So she was not a very shy and kind of this thing timid. She would like to show off. She would like to draw people towards her, attention seeking. While talking, she would jump from one topic to other. She was physically as well as mentally restless. She would need constant stimulation. She would keep moving from one place to other, always multitasking. Emotionally, she was very oversensitive. She could cry easily. She did not like to be told what to do. She would feel the pain of others. She was also very empathetic. She was sympathetic. She was oversensitive. She would feel pain of others, but she was also like a rebel. She did not like people telling her do this, do that. She did not like when her mother would say, don't go to parties, don't go outside. She wouldn't like that. She could not handle stress by herself. She needed a lot of support. She was hypochondriac about her own appearance, her health, and body. So small little thing on her body, one spot, one this, one that, she would feel, oh, what is this? I got one spot. What is this? Is this something? What am I getting? Why is my hair like this? Why is my skin getting so much dry? Or like that. She was very much into her own body. She had a fear of darkness. She had fear of ghosts. She had fear of snakes. She had fear of drowning. Um, she loved nature, gardening, flowers, plants, and her hobbies are to listen to music, reading romantic novels, traveling, and dancing. These were her hobbies. Her physical generals were she had very oversensitive skin. Her skin would react easily to any external factors like bright light. I mean, any external factors in the environmental factors like any allergens or anything. Her skin would, if she goes, in Canada, it is very cold. So in winters also, some people get red cheeks if they go outside. So she said that her skin is so sensitive, she would get those red cheeks. Even if she steps out in cold or even in hot, very hot sun, if she steps out, her cheeks would blush, she would become red. Her speech was very fast, like she was talking very fast. Her appetite was normal. She desires for cakes and chocolates, aversion to spicy food. dreams of getting lost in unknown street, and dreams of being attacked. She shared these dreams. Thermally, she was chilly and she did not sweat much. So now, how do we analyze this case? Any guess for this? Formica rufa, butterfly? Yes. Good. Very good. All right. So she was hypochondriac. Okay. Overly self-centered. Story was all about her. This is a feature of invertebrate. We already saw that it is a feature of invertebrate. She loved to be busy, multitasking. She is talking very fast. This is the basic insect quality. And she was chirpy. She was extrovert. She was communicative. She could not sit at one place. All this is showing the air quality. Air quality means adolescent stage of development. According to Mahesh Gandhi sir's chart, we put this into air. That is the adolescent stage. And again, why adolescence? Because she did not like to be told, right? So this also shows adolescent stage because she doesn't want to be told by others. She has the mind of her own. She wants to do what she wants to do. But although she needed a lot of support from her family, her parents and her husband, she felt her husband is like a protective armor around her. She has the feeling of being vulnerable without him. She was very childish in nature. So whenever that patient is coming, you would see so you have to judge a patient whenever the patient is talking. You need to see what is this patient talking about or how is this patient talking. Is this patient a very well developed? Do you think that this patient is an adult who is talking with you, or it is a childish? Like when always Dr. Gandhi sir has told us, like, is this patient evolving? Are you needing to talk with that patient in a childish way? If that is the case, then that patient is childish. You need to see in those kind of remedies. If the patient is well developed, suppose a patient is talking about the world, the politics, the productivity, the bank balance, how to earn more money, all those things, you need to see in the adult stages or the lower, the fifth subclass or the fifth row or the sixth row, like the fifth row is the performance stage and the sixth row is the around the world, right? According to the Sholton's method as well. So you have to judge this according to what you are getting from the patient. And she was very sensitive to pain, to what others feel, oversensitive, right? She did not like hurting others. She was very sympathetic. So here we see the plant-like sensitivity, just like ranunculus. She also liked traveling outdoors and open nature. Okay. So the remedy given was, yes, butterfly. Dr. Reshma and Akanksha and Bhavika, yes, Limbiaceae. Awkwardness, yes, Monica. There was awkwardness present. More of adolescence, yes, Reshma. That's right. Rebelliousness, yes, correct. So, Lamentis bredovi californica. So, understanding of the case, this is invertebrate. We all saw that invertebrate qualities, the air quality, that is the adolescence, the theme of being like a child without any protection. We also saw that. There is theme of metamorphosis, theme of unprotected adolescence. I have to stand up for myself to protect me. Body awareness or sexuality and family orientation. She did talk about her family. She wanted her family, but here you should differentiate. She is talking about her family, but why does she need the family? She needs the family to protect herself because she feels vulnerable. Okay, so this is Kingdom Animalis, phylum Arthropoda, class Insecta, order Lepidoptera, Nymphalidae, subfamily Nymphalaenae. remedy given was Liamentis bredovi californica or California sister butterfly 200, initially once a week. So this is just a general thing for butterfly stages. We all know that butterflies have 4 distinct stages. The egg stage, the caterpillar, the larva and the cocoon or chrysalis, and eventually the adult butterfly. The first 3 stages of its life can be compared to the child and adolescence to be a baby, child and adolescent, of which the caterpillar stage is the strongest. As most butterflies just last for 3 to 10 days, their principal activity is to reproduce. Once emerged from the cocoon, the male embarks its territory and the female flies around looking for a mate, secreting the substances which attract evils, loving feelings. In order to reduce the danger of hybrids, each species has a unique dance which attracts only its own type. The female flies through the trees, which checking leaves are best placed on which to lay her eggs. Once the perfect spot is found, she deposits the eggs. She deposits it there, and quickly she flies off. Whereas here, unlike those other butterflies, Liamentis butterfly eggs are laid in the open. They are not in the nook or shaded place or a crack in the bark. So that's why they have the feeling of being child without the protection, without adult protection. These eggs are totally left vulnerable to attack. Once the larvae or the cocoons, they are color camouflage, they have the alkaloid protection. The caterpillars as a larva construct their own hyperculanum. This is all the defense mechanism, how they are protecting themselves from the predators. So at that, the cocoon of the Liamentis is hanging house, quietly spinning until the butterfly emerges out. At that moment, the adult breaks out and shakes its wings and then stretches them in the sun to start the cycle all over again. So this was the case. And yeah, the patient improved significantly, and the episodes of depression also were much better. She developed as a person. So whenever we prescribe in this method, we will also see whenever the patient is coming for follow-up, they will say in their follow-ups that you will be able to assess that their ego strength is becoming more developed. They are becoming more so this sensitivity, she had this sensitivity of like plants, right? She couldn't tolerate. So this was getting better and better. And she was able to handle things much better. And eventually, when she was much stronger emotionally, her hives stopped coming. So this was the case. And I thank you to everyone for patient listening and participating. And I'm very much thankful to Dr. Kalathia sir for giving me this opportunity. And also thank sir for his books on arthropoda. You can read arthropoda books from Dr. Kalathia sir. It's really very useful. It has helped me a lot for my material, for the materia medica in insect remedies. Thank you to Dr. Mahesh Gandhi sir for his method of PEM, which has brought us to this level that we are able to analyze in such a way and we are able to prescribe so confidently. And also I have referred to Peter Fraser's book of insects for materia medica. So thank you to Peter Fraser's book of insects. Thank you all.